We'd like to welcome you to C-Suite's conversation with the Charlotte Post Publishing Company, publisher of the Triangle Tribune and the Charlotte Post. Today's conversation, we have Dr. Tunde Sotunde, CEO and President of Blue Cross Blue Shield of North Carolina. We'd like to welcome you to today's conversation.
Great. Thanks, Linda, for having me here and the opportunity to be here today. And I just want to say thank you to you, Gerald, and the rest of the team for all you do to inform and educate our communities, not just here in Charlotte or Mecklenburg County, but across the state and beyond as a whole. So thank you again for all you do.
Well, thanks. I know we were going to get that commercial. I would have had you on earlier.
Thank you.
Thank you.
Well, my name is Linda Johnson. I will be your host today. I would like for you to meet our team. We have Gerald Johnson, our publisher. It's always a pleasure to have Gerald join us for these types of conversation. Along on the team, we have Herb White, our moderator as well. A little webinar housekeeping rules. During the presentation, you can type your questions in the Q&A. Attendees will be kept on mute during the webinar. We ask that you don't use the chat for asking questions. That would be a way for us to communicate to you all information about the publication, to subscribe to the newspapers. We'll have those links in there, the Charlotte Post newspaper and the Triangle Tribune as well. We also have in there information if you like to make a donation to our publication. At this time, with no further ado, I would like to invite our publisher, Gerald Johnson, to take it from here.
Thank you, Linda, for the introduction. And briefly, I want to go over the fact that the Charlotte Post Publishing Company is minority owned. We produce information geared about the African-American community, for the African-American community, and by the African-American community. And it's our job to make sure that we can provide the information that is going to be relevant and truthful and not fake news like a lot of things that's going on now. And so thank you for attending this event. And thank you for Dr. Tunde Sotunde for being our guest speaker. We're looking forward to this conversation. And I'm going to bring in our, and I love saying this, our chief executive editor, Herb White, to talk a little about why the C-Suite started and anything else he wants to say. Herb?
Thank you, Gerald. And my name is Herb White. I'm editor-in-chief at the Post. And C-Suite is an initiative that we launched earlier this year to bridge the gap between what we understand as CEOs and business leaders who are Black North Carolinians. And a lot of times we think of CEOs as these folks who are at a certain level and way beyond our grasp. What C-Suite attempts to do is to bring folks together so that we understand that these folks in these C-suites are actually human beings just like the rest of us. They have stories that are compelling and are motivational because there are plenty of talent out there, and we want to inspire folks to get to these same places that our guests have attained. And so that is the mission behind C-Suites. We humanize folks so that we can identify with these folks and we can aspire to follow in their footsteps. And so because of that, today's guest is Dr. Tunde Sotunde, who is CEO and president of Blue Cross Blue Shield, North Carolina. He's a pediatrician by training, so he knows a lot about infantile behavior. So he's in a good spot today. And before he was hired at Blue Cross Blue Shield, he was president of Anthem's Medicaid and related state government businesses across 23 states and Washington, D.C. and it has 7.3 million members and $33 billion in revenue. So he knows his way around large organizations, which comes in handy at Blue Cross Blue Shield, which is North Carolina's largest insurer with 3.7 million members. And so, having taken up enough of your time, we're going to start with the conversation. And welcome, Dr. Sotunde.
Great. Great to be here. I'm really excited, and I've been looking forward to this conversation.
Well, let's start off with a conversation around not so much where you are, but I'm very interested in who you are, and to get a background on who you are. Let's start off with where you were born and growing up as a child. Tell us that story before we hop into later years.
Sure. So I was born in Lagos, Nigeria, which is on the west coast of Africa. And I was the youngest of 3 siblings. I was born to parents who were both professionals. They had the opportunity to be trained in the United Kingdom and then came back to Nigeria to help develop the country. And my dad was an engineer, and my mom was an administrator in the state-owned public utility company. So I think it's fair to say that I grew up in a middle-class background, but it was still a third world country. But then I had the opportunity to then spend some of my education in the United Kingdom, where I did my undergrad. Came back to Nigeria to do medical school because I always thought that I would, live and work and be of service. And again, in the tradition of my parents, help to develop the country. But then I decided to pursue further training. So I went to the West Indies, to Trinidad in the Caribbean, worked there for a couple of years. And then I finally immigrated to the United States exactly 30 years ago. It's hard to believe that it's been 30 years. I did my pediatric residency at Howard University Hospital. So I'm a Howard alum. And then I, met my wife, who's American. She's a pharmacist by training. And then I got stuck, and the rest is history. And we've been married for almost 26 years now.
Wait a minute. Your wife is not on here, so stuck is not the right word to use. So I'm gonna let that go. But back up a little bit before you get growing up. Tell us about your as a youth, your inspiration and aspiration growing up.
That's a great question. So I, unfortunately, in the late 60s, when I was an infant, I was stricken by polio. It was at the height of the polio epidemic back then in many other countries. I think the US had pretty much gone through it. And I survived. I pulled through after several months, tough months, as my mom would tell the story, without any residual long-lasting effects or impacts. And I grew up hearing my mother, who's 84 years old, and still today, if you meet her, she will tell the story of how I pulled through. She calls me her one and only. I pulled through, that whole, very traumatic period in our lives. And she always told that story as long as I could remember, of how suddenly one day I stopped walking. I wasn't walking anymore. Took me to the hospital. I was admitted to the hospital. The doctors told her my parents, there was nothing they could do, right? Because I had polio. But then she took me home. She said, I will never give up. She took me home and she nursed me for months. She took a leave of absence and nursed me for about 3 months. She had the doctors, Dr. Smith, I'll never forget, come in to do house calls. And that was how I pulled through. So from a very early age, I've been fascinated with the health sciences, the health arts, the art of healing. And also, I've always been acutely aware of the fact that wherever I am or wherever I was at any point in time, it was because others did something for me. And I've always wanted to do something back for others. And that has shaped my life over the years. I would describe it as a purpose-driven life. I got through that for a reason. I'm not sure I know what it is, but all I know is that anything I do has to be around making a positive difference in other people's lives.
Excellent, excellent. Herb, I'm gonna let you, before, I don't want to take up the whole show yet, so jump right in even.
Thank you so much. Dr. Tunde, I guess when you tell this story, is that then the spark that caused you to pursue medicine, or was it just something that was even more organic, that you just grew up thinking one of these days I'm going to be a doctor?
No, I never grew up thinking that I would be a doctor one of these days. It was just that experience, and it's when you hear the story almost every week, it sticks with you, and it just got me so interested in the healing arts. And then I started to read about medicine, and I started to think about it more. I was kind of a rascally kid growing up, to be truth be told. So I wasn't really that studious or paid attention to my studies as maybe I should have. But I always knew at the back of my mind that there was a reason that I had survived that episode. Many people did not survive the polio epidemic, especially in a third world country. Thousands did not survive. And even those that survived ended up with long-lasting, long-term effects or impacts. So the fact that I was able to pull through all the way through, I just knew that there's something, the good Lord has for me in mind. And, medicine, healthcare was just came naturally to me. So I know how to study hard to make it happen.
When you talk about studying and academics, talk a little bit about your academic experiences, not only in your homeland, but also in the UK. You mentioned that earlier in your introduction.
Yeah, it's fascinating because I spent my early childhood. I think I left for the UK when I was about 14 to 15 years old. And, again, I came from a middle-class background. So truth be told, went to private school, had a decent education. Most of our teachers had trained either in the United States or in Britain or in France. So I had, a pretty decent education. But I was shielded to a fair degree until I then left to go to the United Kingdom. And I went to boarding school in the United Kingdom. So I'm thousands of miles away on my own. I was probably 15 when I started on my own, boarding school. I was the only person of color in the entire school. But let me tell you something that's ironic. During that period, I never once thought that I was any different or the color of my skin made a difference. Never once throughout that period. It was not until I came to the United States that, I figured out very quickly that the color of your skin could and does make a difference. And that is a story that I've recounted to my children many times, because I think it's telling in terms of, yes, we're people of color, but it depends on where you are, your experiences could be very different.
Interesting. So as a rascally kid, when did it hit you that, I need to start getting into the books to come up with my future in life. So I mean, when did the light go on for you?
So I think it was in middle school. I was probably, I don't know, like 12, 13. And my biology teacher then, because I was very rascally, and not in a bad way. I didn't do bad stuff, but I was very mischievous and I was always up to something or the other.
So bad is relative, you know, but go ahead.
Yeah, I'm trying to clean it up here. So my biology teacher pulls me aside and she says to me that there's nothing good gonna come out of your life. You're not gonna make anything or be of anything in life. And I will never forget. And I can still visualize that conversation up to today. And that was the wake up moment for me. I was like, no, she didn't. She didn't say that. And she was like, yes. And that was when the light bulb went on in my head. And I said, no. I'm not going to go down that way. So I'll tell you a funny story. Many years later, I finished medical school, complete my training. I'm now a doctor with my white coat. And I go back to my middle school. She's still teaching, right? She was already in her late 60s, but still teaching. And I say to her, do you remember me? And she looks at me and I say, it's Tunde, Sotunde. I said, Dr. Tunde Sotunde. And you should have just seen the look on her face. She couldn't believe it. And then she now says to me, hey, you know what? I have a daughter that I think you need to meet. This was before I was married, by the way. And I was like, oh, this sounds like a setup. I'm out of here. But in a very different way, she was actually the one that inspired me. I know it sounds counterintuitive, but that was really my inspiration to do better.
Interesting.
When you talked about studying in the UK, obviously you are an international traveler because you've been to a lot of different places. Talk about how those experiences, whether it's in the Caribbean or Europe or North America, how does that experience translate to the type of person that you are now?
Well, that's a great question. I think those experiences make me a very diverse person in the true sense of the word, right? Diversity, obviously, in terms of my race and ethnicity, diversity in terms of my backgrounds, my experiences, the way I think about things, the way I approach things. Because in each of those countries, they're very different. They are very different. And you have to adapt, to the environment you find yourself in. So I'm one of those people that I feel comfortable in pretty much any environment. I can be in a room and be the only person of color, and I don't even, it doesn't faze me at all. I could be, in a room and, you have the top scientists, the Ivy League, doesn't faze me. And I could be in a room with our people, our communities. And I just look at myself as a man of the people, one of the people, right? So I think those experiences more than anything else, right? The diversity of those experiences and having to adapt has really shaped the way I think about life, the way I approach life, and my leadership philosophy, which is always about servant leadership. It's always about servant leadership. And I have to give, credit to my dad, because my dad instilled in us at very, very early ages the importance of humility, of empathy, of compassion, of always treating anybody around you, irrespective of their socioeconomic education status, whatever it is, as an equal. And always do what you can for others first.
Interesting. So let's jump through now. We've gotten you through Howard, and now you're off doing your I guess pediatric work at that time. And so how sort of walk us through that. Now you're a doctor, you're treating children. Was this sort of a place that you felt like this is where you wanted to be, or this was just a start for you? How did you feel about when you were doing this work?
Yeah, that's a great question. So, when I went into medicine, I always thought that actually I wanted to do obstetrics and gynecology. That's what I wanted to do. But then I went to do my pediatric rotation, and it struck me that kids are so vulnerable, especially at younger ages. They can't tell you what's going on. They can't tell you what's wrong. And when kids are sick, they look really sick. I mean, it is heartbreaking. And then, of course, the parents, I mean, they're totally at loss. And I don't know, it probably goes back to that, underlying need within me from very early childhood to always do whatever I could for others, particularly those that need help the most, that then resulted in me, changing course and studying pediatrics. When I finished pediatrics at Howard, then I now went up to upstate New York to practice in a federally qualified community health center in upstate New York from Washington, D.C. So you can imagine the cultural, not even to talk about the geographic divide. Why did I do that? Because one of the doctors in the Federal Qualified Health Center had come to talk to us as we were graduating from Howard. And he said, do you know that Syracuse, New York has one of the highest infant mortality rates, not just in the country, in the world. It's actually higher than many third world countries. And I was like, in America, what is he talking about? So I went up there in the summer. If I had known what the winters were like, I don't know that I would have ended up there. I went up there in the summer. I finished residency in June, went up there in July, and started practicing, providing care to the most vulnerable. While I was there, I had the opportunity, I would probably say one of my first professional mentors throughout my career. My number one mentor is my dad, no question. But professionally was a doctor by the name of Dr. Grinnell. Dr. Grinnell was African-American, or is African-American rather, and was a pediatrician. She had a MBA, Master's in Business Administration, and she was the medical director of the Community Health Center. And I was like, I didn't know doctors could do other things outside of treating patients. It was like totally foreign to me. So I went to her and I said, hey, I'm really interested in learning more about medicine and care delivery. And she said, yeah, I'll teach you. Next thing, she made me head of pediatrics, chief of pediatrics for the Community Health Center. Next thing, I went back, got an MBA. Next thing, I ended up, on the health insurance side of the delivery system, because I wanted to figure out what do they do up there? We're right here providing care. What's happening upstream, right? And then I figured out, you know what? I can actually do a lot more. I love the practice of medicine. I miss practicing medicine every day. But I just knew from a population health perspective, I could make more contributions in a system of care than I could in a clinic seeing one patient at a time.
Interesting.
Is there, I guess there is obviously that correlation, but do you consider yourself today to be a business leader and an executive who has medical experience, or are you a medical professional who just happens to be an executive?
That's a great question. I will always be a medical professional. So I think of myself as a physician executive, right? I'm a doctor first, an executive, after the fact. So could I be doing what I'm doing? Heading one of the health systems here in North Carolina? Yes. They're transferable skills, but I'll always be a doctor. There's no question about that.
But how much in terms of the position, how much juggling do you have to do in terms of, well, the doctor in me says this is what we should do, as opposed to as the executive, can you bring some of that doctor's touch to the job?
I think that is one of the advantages, frankly speaking, that people in my role have. Frankly speaking, I say this to my colleagues all the time. More of us need to be doing what I'm doing today. There's no question about that, right? Because of what you said. When I approach situations, as you can imagine, I am approaching the situation within the lens of what is in the best interest of the health and well-being of this individual. I took an oath, do no harm, the Hippocratic Oath. And till my dying days, I will stand by that oath. That is what is involved in making the sacrifice, many years of training and so on, to go into the healing arts. So that will never change. It does give me a tremendous, I believe, my peers might have a differing opinion, but I do believe that it does give me a tremendous advantage because I can look at things more holistically. I have been there. I have been in the front lines. I have treated patients. I have seen patients from birth all the way through. So I know what it's like to be in those shoes. I'm a patient myself today. So I know what it's like to be a patient. I know what it's like to be a physician. And I understand or know what it involves to run a business. But it's a business of healthcare. It's not just any business. And you have to bring a different perspective and a different approach to it because you're dealing with people and people's lives and well-being.
So it's not like it's manufacturing or anything like that. You're talking about flesh and blood and the product that it impacts them.
Exactly. It's different, very different.
Okay, so let's move a little forward to talk a little about where you are now. You're at Blue Cross Blue Shield, North Carolina. And what I'm trying to get a feel for now, you just get a call and say, we're looking for somebody because we have an opening, or did you say, well, I'm looking through the want pages and here's a job? Walk us through that transition of getting into Blue Cross Blue Shield, North Carolina.
Yeah, so to be fully transparent, I was actually planning on retiring.
Retiring?
Yeah, I know I look young, but let me qualify that. I was planning on, to some of what Herb said earlier on, to retire from corporate America, working for an institution. And really spend, I wanted to spend at least last 5-10 years of my career giving back. Really going back to teach medical students and residents, which I've always enjoyed. I spent time at SUNY Health Science Center in upstate New York. I spent time at Vanderbilt University Medical Center. So that's something that's always been a passion of mine. And also to do mission trips and then spend my time, really, in charitable pursuits and so on. That's really what I wanted to do, while I still had the strength and the energy to do so. But then, I was approached by a couple of folks about the opportunity in North Carolina. And I was like, I wasn't looking, and I'm a believer in fate and destiny. I was like, why is this thing happening at this time when I'm just about, to make an exit? And I started to read more about North Carolina, and I was really intrigued by North Carolina, really intrigued. The geography, the fact that 80 of 100 counties, I believe, are considered rural, and when you think about my background, it's kind of ironic as I've been touring the state. It's like deja vu. It's like some of what I'm seeing in rural areas of our state are no different than what I saw growing up in Nigeria or even in the West Indies, right? And then you look at issues, social issues, right? The social drivers of health, infrastructure, transportation, proper food and nutrition. Do you know that North Carolina, at least the last number I saw, were the 10th hungriest state in the country? You look at health rankings, right? There are lots of organizations that rank the health across many domains: access to care, equity, disparities, everything you can think of. And then they rank each of the 50 states, including the District of Columbia in the United States. And do you know that for the last few years, I've looked back at least 3 or 4 years, North Carolina is always in the bottom third. So I was like, there's a calling for me here, right? Maybe there's still one more act, and let me go see if I can make a difference. And then guess what? COVID.
Yeah.
COVID. I started on the 1st of June at the then height. I can't say height of the pandemic anymore because we've had different heights over time, right? Of the pandemic. You might recall that June 1st was the weekend following all the riots, right? That just were all over the place following the events leading up to the tragic killing of George Floyd. I drove out of Atlanta to Durham, North Carolina, going past National Guard, because there was just total social unrest, because people were tired and fed up and frustrated. So those were the events that led into my arrival into North Carolina. And I was like, there was a reason. There was a reason.
So instead of turning around, you looked at the challenge and said, I can do this. I gotta do this.
I gotta do this. If not me, who will? I gotta do this.
So now that brings up another point in terms of activism in health care delivery. A lot of people now are talking about equity and making up for past misdeeds in certain industries and professions. As the leader of Blue Cross Blue Shield North Carolina, how does your organization fit into that narrative in terms of making sure that there's equity for everyone, especially for those groups that have been historically marginalized? And you talked about North Carolina being a predominantly rural state still, even though there's a lot of growth in the cities. So how does Blue Cross Blue Shield fit in?
Oh, absolutely. I mean, we have to take a leading position, and we have, frankly speaking, on health equity. In fact, I describe it as lack thereof, health equity. We've talked about health equity for many years in healthcare. It's nothing new, right? And we talked about health disparities. I as a healthcare professional, I've always known. But what was different in the past 12 to 14 months or 15 months was when all of us saw how COVID was disproportionately impacting people of color, minorities, people of diverse racial and ethnic backgrounds, underserved communities, and so on. They were getting it and dying from it at disproportionately higher rates than any other segment of the population. So at Blue Cross, we were like, we've done a lot. We've done a lot. There's no question about that. Over 50% of our workforce today are people of diverse racial and ethnic backgrounds. We've made Forbes list many years as one of the leading employers for diversity, equity, and inclusion. And then, of course, look at me as the CEO. But we said, we have to do more. We must do more. So what did we do? For the first time in our history, we issued a public statement. Actually, it was my day 3 on the job. I remember it was a Wednesday, I think, where we said no community can be truly healthy until racism, discrimination, bias no longer exists. That was one. We then very quickly put together a diversity council that I lead. And we have 3 priorities. We set 3 priorities for us as an organization with respect to diversity, equity, and inclusion. One is that our workforce will be fully representative at all levels of the organization, top to bottom, left to right, whatever, of the population, the diversity of the population in the communities that we all live and work in. With respect to our recruitment, our retention practices, and so on. So we've been doing a lot of work with the HBCUs, North Carolina A&T, North Carolina State, all of them. We've been doing a lot of work with the HBCUs and other institutions so that we can develop a pipeline. That's one. 2 is health equity. We know that the social drivers, non-medical drivers, transportation, food, access to basic services, impacts one's health and well-being, access to mental health, basic primary care services. So what are we doing? We're developing a health equity index. So to allow us to measure in a data-driven manner, what are these disparities? What are these differences? Race, ethnicity, gender, sexual orientation, geography, because we know the differences rural and urban. And then once we know exactly what they are, what are the drivers, and then what are the actions or interventions that we can take to address them? And then we're going to measure over time. Our goal, I mentioned to you, state health rankings, we're the bottom third as a state. Our goal, even though, we don't, I wish we covered, all North Carolinians, but we don't. We cover close to 40%. But we still have a goal that North Carolina, in 5-10 years at the max, should be at the top third and no longer at the bottom third. It's going to take a coalition of the willing, all of us, including you. You play an important role. I started off saying you inform and educate. So you play a critical role. All of us, public-private sector partnerships have to play a role. That's what's taking us through this COVID pandemic. We all came together. We galvanized around, the 3 Ws, vaccination drives. You did a lot of, messaging in that regard. So it's going to take a coalition of the willing for us to address health equity. And then the third priority area, it has become clear to us, economic mobility is critically important. We cannot address health equity unless we address economic mobility. So we are, as we speak, going back to take a look at all our—
Good afternoon. Thank you for calling Charlotte Post. May I help you?
How we make our investments within our communities, but doing so in such a manner so that it drives towards economic mobility. One of the things we did last year was we raised minimum wage to $16 an hour. We did it very quietly. We didn't, no fanfare. We just raised it $16 an hour. Why? Because we know that there's a disproportionate amount of people that are of diverse racial and ethnic backgrounds, people of color, in the front lines. So we said, at least let us help, because we have control over that, because then we increase their minimum wage, they then go back and spend within communities, and that helps to elevate the communities. Diversity supplier spend is another thing. We have a target to double our diversity supplier spend in the next 5 years, double. So we have a great role to play, even outside of everything I've said, in terms of continuing to advocate and to push all of us, because we can't do it alone. We have to push each other, hold each other responsible and accountable. And if we do it right, there's no question in my mind that we will drive towards better, simpler, more affordable healthcare and healthier communities for all of us here in North Carolina.
Interesting.
Now, you also talked about coalitions of the willing and equity. I want to throw this out here in terms of leadership. Nothing happens in corporate circles or social circles, for that matter, without someone stepping forward and say, we will be responsible and accountable for doing things. Talk a little bit about leadership at Blue Cross Blue Shield and how your leadership team, and I guess it's a two-part question. One would be, what makes good leadership in your estimation? And how do you, as the chief executive at Blue Cross Blue Shield, how do you put together a solid, capable leadership team?
That's a great question. So let me start off with good leadership. I believe that you have to lead with purpose. You have to have purpose in life. And our purpose, we just revised our purpose statement. Some would often refer to it as mission statement, one and the same at the end of the day. That, as an organization, our goal is to improve the health and well-being of our customers, but not only that, of our communities. And that we will not stop until healthcare is better for all. And I truly believe that you have to have purpose, because when you have purpose, then you can lead. In terms of what makes a good leader, I don't know that there's any one right answer, but I tell you what I do know, which is you have to lead with purpose, as I said. You have to lead with compassion. You have to lead with empathy. You have to lead with humility. And as my mother, one thing that my mother always used to say growing up, if you believe it's the right thing, never give up. The right thing is always hard. It's always hard. The hardest thing to do in most cases is the right thing, but never, never give up. And that's a leadership principle or philosophy that has stayed with me. In terms of building the team, I will tell you that we have not the entire team, our 5,100 associates, employees, teammates, and so on they're just the A team. They're the all-star team. I refer to them as the all-star team. Truly, they are really the all-star team, because we are a mission-driven non-for-profit. We're a mission-driven non-for-profit. So, like I tell people, our shareholders are the people and communities here in North Carolina. Our shareholders are not on Wall Street. I work for all of you. We work for all of you. We work for all North Carolinians. And that's the difference. So what you find when you look at our team is that folks are there because they really believe in what we're doing. There's no question about it. They could earn more or go to greater heights in other elsewhere, but they want to be here because of what we do. And my team will tell you, I strive for excellence. You know why I strive for excellence? And I tell the team, it's not about us, because the people we serve deserve nothing but the best. And we're going to give them the best. And I know I drive my team. I will be the first person to confess. But we have to. We have to. We're talking about people's lives, people's health, people's well-being. So we must strive for excellence.
So this is and you're in getting to where you are, and even now where you are. You said the first time you ran across color barriers in terms of people who's looking at you differently because of the color of your skin. Since you've been here and coming to where you are now, what sort of issues have you seen or experienced in your career path in the States here?
Yeah,
So
so,
this is the States, so it is here, but go ahead.
yeah, so I would say, I mean, I'll be honest, I don't know that I can say that I have experienced what I'll describe as overt racism or discrimination. But I've experienced subtle, or maybe not so overt, discrimination. I'll give you just some examples, in professional life, as I was navigating through corporate America and all of that, you'll be in a meeting and I'll say, well, I think, that, we should do this, though. I think this is what we need to look at. And nobody will say anything, and you kind of just dismiss it. Then 30 minutes later, a colleague of mine, would then say the same thing. And I'm like, wait. I just said that like 30 minutes ago. So then I thought, maybe it's my accent. So I put it in writing. Same thing. I sent an email. Nobody answered. Somebody else, then everybody's like, yeah. That's the best thing since sliced bread. And I'm like, you know what? Forget this, right? Another example, so I knew the lesson. The lesson was, you know what? You got to work harder. You got to work smarter than everybody else. You got to take the stuff that nobody else wants to do, because that's probably all you're going to get. But you take it and you turn it around, and now everybody wants it. So my first opportunity to run an organization, it was a small organization within a larger organization, but I had my own, plan, budget, and everything, and I was responsible. I was the president of that unit. It was very bad. That business was on life support. In fact, when they asked me, when I said put up my hand to do it, what my then boss told me was that either figure it out in a year and a half, and if you don't figure it out, we're going to shut it down. So I was like, okay. Cut a long story short, in 3 years, it was the top performing business unit in the organization. No question about it. Across every dimension, everything you wanted to look at. Quality of care, member satisfaction rates, employee satisfaction rates, financial measure, anything you want. We had the highest accreditation status, anything you wanted to look at in 3 years. But again, it goes back to, you have to take what nobody else wants to take. So I'll leave you with this. The same was the person that hired me. We were at a large company event, and my unit got a prize, obviously. He pulled me aside and he said to me, I can't believe that somebody like you was able to turn this around. And it took me a few minutes. I was like, oh, thank you, and I was like, what does it mean, somebody like me? What does that mean? And then it struck me. I was the first person of color, African American, to run any business unit of any size in that organization. I was the first. So anyway, But you can't let other people put you down now.
Yeah.
Keep on going.
And the interesting thing about all of the C-suite interviews that we've had, the one lesson that's been clear from all of you is when we run into a roadblock, we don't let that stop us. We just keep pushing on. We just keep pushing on, and all of us run into roadblocks. And so, and this is why the C-suite conversation is so important to us, is because that story has to resonate with not only us, but with younger people coming along, because that's just a great inspirational story to help people understand. As long as you keep pushing, you will reach where you need to go. You just can't let anything kind of get into your way to stop you from achieving your goals.
Yeah, but Gerald, I'll tell you, it's unfortunate because it's hard. I don't know what the other CEOs told you, but it can get physically, mentally, and emotionally exhausting. But you keep on going, and what really keeps me going is kind of what you alluded to. I think about the people behind me, and I say, today you gotta go. You just trust me. I'm not doing this for myself anymore. At a younger, earlier part of my career, not anymore. I'm just thinking, the people behind me. I just gotta continue to blaze the trail and create a path, because if not, it's hard. It's hard.
Yeah. So now you talked about the stress that's involved with this business. What do you do to let off steam? I mean, I assume at some point in time you go home.
Yes.
What do you do when you're away from the office?
Yeah, so I try and spend family time, because in our professions it's like 24/7, honestly speaking. So when I'm home, I'm really home. I really try and spend family time, even more so during the pandemic, because the kids have been home and so on, and we've been in lockdowns and so on. So instead of sitting in the office or whatever, I basically, like, at 6:30 I'm done, unless it's a national emergency. I'm gonna have dinner. We're gonna have dinner, as a family, even though the kids have their devices and all of that, but at least we're all there. So that's really what I try and make sure that I spend time doing. I used to play golf, and I enjoy golf, but unfortunately, time constraints. I just felt that it's not something that I could do unbalanced, right? And something had to give. I tell you what I really like doing. And then, of course, I read a lot. Doctors are always reading something or the other, and even more so during COVID. But, I like to travel. I love to travel. That's my passion. If I wasn't a physician, I'd probably be a commercial airline pilot. So thank God.
What?
That I didn't do.
A pilot, okay.
Yeah, a pilot. Yeah. I that's actually one thing that I plan on doing. Once I finally slow down, I'm going to finish getting my hours and getting a pilot's license. I've held up to this point because my wife tells me that our life insurance is not enough. I have all these kids to feed and send to school. So I've been grounded for a little while, but I think I'm about 4 or 5 years, and then the loss will be gone, and then we're good to go.
So you started that process then?
Yeah.
So now, as a traveler, we've heard about all the places you have been. Where's the one place that you would really love to go that you haven't been to yet?
That's a great question. I would say India. India is the one country that I've not been. Then I'd probably say New Zealand, Australia, probably 2 and 3, but almost everywhere else. I've been to the Middle East, been to Far East, China, Hong Kong, Japan, been all over, those countries, Caribbean, obviously. We love the Caribbean. I think, I have Jamaican blood sometimes because I just love going to Jamaica. But I would probably say, I'm just fascinated about India. India has a lot of culture, a lot of history, and it's just a huge geography.
What's the one item that you have to take when you travel?
my blood pressure pills. How about that?
But yeah, that would be helpful.
Oh, I thought you covered up with another one, Herb.
Oh, no.
No.
Oh,
I mean, I don't think you can top blood pressure medication.
No, that's my blood pressure pills. You know, maybe in future we'll have to take my COVID vaccine passport, but for now it's just my blood pressure pills. You know, I've traveled so much that I have, you know, I'm totally comfortable traveling. I can pick up and go. I've done it before. I've left from Atlanta Thursday night to Lagos, Nigeria to go see my mom. I've been back on the plane Sunday night. I'm back at work Monday morning. I've done it quite a few times.
So there must be some jet lag pills that you're.
That's a long flight.
You know the trick. You know the trick. Wherever you are, cycle to that time zone. So if you land and it's dark, you better figure out a way to go to bed. Go to sleep. If you come back and it's light, stay awake, even though you might be so tired. So just cycle your body to whatever the time zone is there as soon as you get there. And in about a day or two, you'll be fine. No jet lag. I don't get jet lag anymore.
That's spoken like a true doctor.
Yeah.
Travel tips?
Assuming regular people can't do that. Okay, anything else, Herbert?
Oh no, I think this is it. This is good.
We're running to the end of the hour, and one thing that we don't like to do, especially with people that are busy, is to keep them past the hour time frame. But if there's anything else you would like to add before we close this out, let me just say that I want to thank you again. This was a fascinating conversation, and I learned a lot. Hope everybody else did, but it was enjoyable finding out more about you and just who you are, what makes you tick. So thank you again for joining us this afternoon. And if there's anything you'd like to say to us or the audience, feel free.
No, I'd just like to say again to Gerald, Linda, and Herb, thank you for all you do. I mean, you really are the unsung heroes, right? Because information is knowledge, and with knowledge, you can do something about it. So thank you for all you do. And I just hope from this series of C-suite conversations that one thing that people will take away is that we're just human beings. We're no different than anybody else. I've always said, I don't want anybody to remember me for being a CEO of anything. I want people to remember me for having made some positive contribution to make a positive difference in people's lives. That's really all that matters. So again, thank you for the opportunity to be here today.
Oh, that was a great closing statement. Thank you.
Thank you.
Thanks
again. Yeah, thanks.
Stay safe. Stay safe. Get your vaccination. Wear your masks.
We've had the vaccinations already, so the mask is another story. Yeah, that's true. So thanks again, and you stay safe as well.
You too. Take care.
All
Bye
right.
now. Nice meeting you.
Thank you. Thank you.
Bye, Linda.